Again, if you're just tuning in now, that was Mark Sullivan, the CEO of Catholic Health, talking about Catholic Health side of the negotiations, as just at 6 o'clock this morning, 2,200 CWA union members went on strike, hundreds of them on the picket line right now. Of course, there are two sides to every negotiation, and we heard from CWA officials earlier this morning. Let's go out live to our Karis Belger, who spoke with those CWA union officials this morning. Karis?
Good morning, Melissa. In fact, we heard from them not too long ago. They just wrapped up their press conference, but behind me there are so many people. I'm sure you can see a huge crowd behind me, and it's expected more than 1,000 people will be out here today. I can tell you that when we heard from CWA officials, they said they had started negotiations from yesterday morning at 9 a.m. and they stopped at 3:30, and they just could not come to an agreement. The exact words that were used were too little, too late. And we understand that it's not just the wages, it's also healthcare costs for the workers, and it's also the staffing ratios from workers to patients. These are just some of the things that we've been hearing from people. They say they will be out here as long as it takes. We know that they will be having people show up in shifts outside the hospital throughout the day. But really quickly, I want you to hear a little bit of what they had to say earlier today.
Spoke to the hospital before we left and let them know that we would be willing to get back to the bargaining table whenever they're ready. There were some productive discussions that occurred over the last couple of days, but unfortunately just turned out to be too little, too late.
I should mention that the CWA staffers that we heard from did say that they want to get back to the table, they want to continue negotiating, and they are hoping that they can come to a resolution, but right now they were not able to agree with Catholic Health on terms, and so they will be out here for the remainder of the day. I'm going to be keeping you updated throughout the morning, and I will make